Phlebotomy Certification Exam Chain of Custody Questions. Question 1. For illegal blood alcohol collection, which requirement is especially important while preparing a CBC specimen in the preoperative testing area? Option A. Use alcohol swabs for every blood alcohol specimen. Option B. Maintain chain of custody documentation and use the required non-alcohol antiseptic if specified. Option C. Leave the specimen unlabeled until court. Option D. Let the patient carry the open tube to the lab. The correct answer is option B. Maintain chain of custody documentation and use the required non-alcohol antiseptic if specified. Legal specimens require strict identity, handling, and documentation controls to preserve admissibility and integrity. Alcohol antiseptic may contaminate alcohol testing and may be prohibited by protocol. Unlabeled legal specimens break traceability. Allowing the patient to carry an open specimen compromises custody and security. Question 2. For a patient/INR collection, which action best supports chain of custody for a drug screen specimen? Option A. Use only verbal handoff with no signatures. Option B. Store the specimen in an unlocked public area. Option C. Document each person who handles the specimen from collection to transfer. Option D. Discard the seal after collection. The correct answer is option C. Document each person who handles the specimen from collection to transfer. Chain of custody proves who had control of the specimen at each step. Verbal handoff alone does not create a traceable legal record. Unsecured storage can compromise specimen integrity. A broken or discarded seal weakens evidence of tamper control. Question 3. Why are tamper-evident seals used on forensic or workplace testing specimens while preparing a basic metabolic panel specimen in the dialysis-adjacent clinic? Option A. They replace patient consent. Option B. They make refrigeration unnecessary for all tests. Option C. They prevent the need for a requisition. Option D. They help show whether the specimen was opened or altered after collection. The correct answer is option D. They help show whether the specimen was opened or altered after collection. Tamper-evident seals support specimen integrity by making unauthorized opening visible. A seal does not replace required consent or authorization. Temperature requirements still depend on the test. A requisition or custody form is still needed for proper processing. Question 4. When a butterfly set is used for a coagulation tube, why may a discard tube be needed first while preparing a blood culture specimen in the student skills lab? Option A. The tubing airspace can underfill the citrate tube and disturb the blood to additive ratio. Option B. The discard tube warms the patient's arm. Option C. The discard tube removes EDTA carryover from the skin. Option D. The discard tube replaces patient identification. The correct answer is option A. The tubing airspace can underfill the citrate tube and disturb the blood to additive ratio. Coagulation testing requires a properly filled citrate tube, and butterfly tubing can contain air that affects fill volume. A discard tube is not used to warm the arm. EDTA carryover is managed by order of draw, not by removing it from the skin. No tube can replace proper patient identification. Question 5. If no blood enters the tube after needle insertion, which action is safest first while preparing a fasting glucose specimen in the occupational health clinic? Option A. Probe deeply until blood appears. Option B. Gently adjust needle position while staying within policy and patient comfort limits. Option C. Turn the needle in circles under the skin. Option D. Leave the needle in place while searching for another vein. The correct answer is option B. Gently adjust needle position while staying within policy and patient comfort limits. Small, controlled adjustment may correct positioning without excessive tissue trauma. Deep probing increases pain, hematoma risk, and nerve injury risk. Rotating the needle under the skin is traumatic and not appropriate. A needle should not be left in one site while searching elsewhere. Question 6. A patient reports sharp, electric pain down the arm during needle insertion. What should the phlebotomist do while preparing a type and screen specimen in the blood collection station? Option A. Advance deeper to pass the nerve. Option B. Ask the patient to ignore it until the tube fills. Option C. Stop the draw, remove the needle safely, and follow facility procedure. Option D. Release pressure only after all tubes are collected. The correct answer is option C. Stop the draw, remove the needle safely, and follow facility procedure. Sharp radiating pain can indicate nerve irritation or injury, so the draw should be stopped promptly. Advancing deeper can worsen nerve injury. Ignoring the symptom places the patient at unnecessary risk. Continuing tube collection delays the response to a possible complication. Question 7. During a difficult draw, why should excessive probing be avoided while preparing a lipid panel specimen in the outpatient clinic? Option A. It improves all specimen results. Option B. It sterilizes the vein. Option C. It prevents the need for patient identification. Option D. It increases pain, hematoma risk, and possible nerve or tissue injury. The correct answer is option D. It increases pain, hematoma risk, and possible nerve or tissue injury. Excessive needle movement can damage tissue and compromise patient safety. Probing does not improve laboratory accuracy. Needle movement has no sterilizing effect. Patient identification is always required regardless of draw difficulty. Question 8. If a vein collapses during evacuated tube collection, which change may help on a redraw while preparing a troponin specimen in the hospital unit during morning rounds? Option A. Use a smaller tube, syringe, or winged set according to policy. Option B. Use a stronger vacuum tube on the same fragile vein. Option C. Keep the tourniquet on for several minutes. Option D. Tell the patient to pump the fist continuously. The correct answer is option A. Use a smaller tube, syringe, or winged set according to policy. Reducing vacuum or improving control can help fragile veins tolerate collection. A stronger vacuum can worsen collapse. Prolonged tourniquet time can alter results and increase discomfort. Continuous fist pumping may affect analytes and does not solve vein collapse. Question 9. In the urgent care laboratory, which site should generally be avoided unless specifically approved by policy or provider order? Option A. A well-palpated median cubital vein. Option B. A foot or ankle vein. Option C. An acceptable dorsal hand vein. Option D. A suitable cephalic vein. The correct answer is option B. A foot or ankle vein. Foot or ankle draws carry higher complication risk and often require special approval. The median cubital vein is a common routine site when suitable. A dorsal hand vein may be acceptable when antecubital veins are unavailable. The cephalic vein can be appropriate when assessed carefully. Question 10. Why should an arm with a dialysis fistula usually be avoided for routine venipuncture while preparing a hemoglobin A1C specimen in the pediatric clinic? Option A. The blood in that arm has no cells. Option B. All tubes drawn from that arm turn blue. Option C. The fistula must be protected from injury, infection, and altered blood flow. Option D. It eliminates the need for a tourniquet. The correct answer is option C. The fistula must be protected from injury, infection, and altered blood flow. A dialysis access site is medically important and should not be used for routine blood collection without specific authorization. Blood in the arm still contains cells. Tube color is determined by the collection container, not the arm. Tourniquet decisions do not remove the risk to a fistula. Question 11. Why is the site of a prior mastectomy often avoided for venipuncture while preparing an electrolyte panel specimen in the long-term care unit? Option A. The veins always contain arterial blood. Option B. The skin cannot be cleaned. Option C. All specimens from that side clot immediately. Option D. Lymphatic changes can increase risk for swelling, infection, or complications. The correct answer is option D. Lymphatic changes can increase risk for swelling, infection, or complications. Mastectomy with lymph node involvement can affect lymph drainage, so the opposite arm is preferred when possible. Venous blood does not become arterial because of mastectomy history. The issue is not an inability to cleanse skin. Specimens do not automatically clot because of collection side. Question 12. When N4 is running in one arm, which collection choice is usually preferred while preparing a therapeutic drug level specimen in the mobile collection site? Option A. Use the opposite arm when available and follow facility policy. Option B. Draw above the 4 site while fluid is running. Option C. Collect directly through the 4 tubing without authorization. Option D. Ignore the 4 because additives prevent contamination. The correct answer is option A. Use the opposite arm when available and follow facility policy. Using the opposite arm helps prevent dilution or contamination from 4 fluids. Drawing above a running 4 can contaminate or dilute the specimen. Line draws require authorization and specific procedure. Tube additives do not correct 4 fluid contamination. Question 13. When preparing for collection, which finding makes a venipuncture site a poor choice in the emergency department bay during a competency review? Option A. A vein that is palpable and resilient. Option B. Edema, burns, scarring, or signs of infection at the site. Option C. Clean intact skin over an antecubital vein. Option D. A site that allows safe patient positioning. The correct answer is option B. Edema, burns, scarring, or signs of infection at the site. Compromised tissue can affect specimen quality and increase patient risk, so another site should be chosen. A palpable resilient vein is generally a favorable finding. Clean intact skin supports safe site preparation. Safe positioning is desirable for venipuncture. Question 14. A swelling begins forming around the puncture site during collection. What should the phlebotomist suspect while preparing a ammonia specimen in the physician office lab? Option A. Proper tube mixing. Option B. Successful fasting status. Option C. Hematoma formation. Option D. Normal clot retraction in the vein. The correct answer is option C. Hematoma formation. Swelling during a draw suggests blood is leaking into surrounding tissue, forming a hematoma. Tube mixing happens after collection and does not cause local swelling. Fasting status cannot be determined by puncture site swelling. Clot retraction is a laboratory process, not a normal event around an active needle site. Question 15. If a hematoma starts to develop during venipuncture, which action is appropriate while preparing a lactate specimen in the community health screening event? Option A. Continue filling all ordered tubes. Option B. Massage the swollen area vigorously. Option C. Ask the patient to bend the elbow tightly. Option D. Release the tourniquet, remove the needle, and apply pressure. The correct answer is option D. Release the tourniquet, remove the needle, and apply pressure. Stopping the draw and applying pressure limits further bleeding into the tissue. Continuing the draw can enlarge the hematoma. Vigorous massage can worsen bruising and tissue injury. Bending the elbow can increase bruising and does not provide focused pressure. Question 16. A patient becomes pale and says they feel dizzy during a blood draw. Which response is safest while preparing a CBC specimen in the preoperative testing area? Option A. Stop the draw, remove the needle, lower the patient's head or position safely, and seek help as needed. Option B. Ask the patient to stand up and walk it off. Option C. Leave the needle in while getting more tubes. Option D. Give the patient food before removing the needle. The correct answer is option A. Stop the draw, remove the needle, lower the patient's head or position safely, and seek help as needed. Dizziness may signal syncope, so the priority is preventing injury and stopping the procedure safely. Standing can lead to a fall. Leaving the needle in place while symptoms progress increases injury risk. Food is not the first action while a needle is still in the arm. Question 17. After drawing a patient who takes anticoagulants, what post-puncture step is especially important while preparing a patient/INR specimen in the Oncology Infusion Center? Option A. Skip pressure to avoid bruising. Option B. Apply firm pressure longer and verify bleeding has stopped before bandaging. Option C. Ask the patient to bend the elbow sharply. Option D. Use the same bandage time for every patient without checking. The correct answer is option B. Apply firm pressure longer and verify bleeding has stopped before bandaging. Patients on anticoagulants may bleed longer, so pressure and reassessment help prevent continued bleeding or bruising. Skipping pressure increases bleeding risk. Bending the elbow can promote bruising instead of controlled pressure. A fixed time without checking may miss ongoing bleeding. Question 18. For a basic metabolic panel collection, which action helps prevent a hematoma after removing the needle? Option A. Have the patient bend the elbow tightly. Option B. Rub the puncture site to spread the blood. Option C. Apply clean gauze with firm pressure while the arm remains straight. Option D. Remove the needle before releasing the tourniquet every time. The correct answer is option C. Apply clean gauze with firm pressure while the arm remains straight. Focused pressure with the arm straight helps seal the puncture site and limit bruising. Bending the elbow may increase leakage into tissue. Rubbing can disrupt clot formation and worsen bruising. The tourniquet should be released before needle removal to reduce pressure in the vein. Question 19. Bright red pulsating blood appears unexpectedly during a draw. Which concern should the phlebotomist consider while preparing a blood culture specimen in the student skills lab? Option A. Proper venous flow. Option B. Tube additive carryover. Option C. Normal capillary refill. Option D. Possible arterial puncture. The correct answer is option D. Possible arterial puncture. Pulsating bright red blood can indicate arterial access and requires stopping the procedure and applying pressure. Typical venous flow is darker and not pulsatile. Additive carryover affects specimen chemistry, not blood pulsation. Capillary refill is assessed in tissue color return, not tube blood flow. Question 20. After reviewing the order, which tube is collected first when blood cultures are ordered with other venipuncture tubes? Option A. Blood culture bottles or sterile culture tube. Option B. Lavender EDTA tube. Option C. Gray fluoride tube. Option D. Serum separator tube. The correct answer is option A. Blood culture bottles or sterile culture tube. Blood cultures are collected first to reduce contamination of the sterile specimen. EDTA tubes are collected later to prevent additive carryover. Gray tubes are generally collected after other additive tubes. Serum separator tubes do not take priority over sterile blood culture collection. Question 21. In the standard venipuncture order of draw, which tube usually follows blood cultures while preparing a type and screen specimen in the blood collection station? Option A. Lavender EDTA tube. Option B. Light blue sodium citrate tube. Option C. Gray fluoride tube. Option D. Royal blue tube for every test. The correct answer is option B. Light blue sodium citrate tube. The light blue citrate tube is collected early to protect coagulation testing from additive contamination. EDTA is collected later because it can interfere with coagulation and chemistry tests. Gray fluoride tubes are usually near the end of the order. Royal blue tubes are used for specific trace element testing, not as the universal second tube. Question 22. In a routine phlebotomy scenario, which order is most appropriate for collecting blood cultures, light blue, serum, green, lavender, and gray tubes? Option A lavender, gray, green, serum, light blue, blood cultures. Option B gray, lavender, green, serum, light blue, blood cultures. Option C blood cultures, light blue, serum, green, lavender, gray. Option D serum, lavender, blood cultures, gray, light blue, green. The correct answer is option C. Blood cultures, light blue, serum, green, lavender, gray. The standard order minimizes additive carryover by collecting sterile cultures first, citrate early, then serum, heparin, EDTA, and glycolytic inhibitor tubes. Starting with lavender risks EDTA contamination of later tubes. Starting with gray places fluoride/oxalate before tubes that could be affected by carryover. Placing cultures after non-sterile tubes increases contamination risk. Question 23. Why does order of draw matter during evacuated tube collection while preparing a troponin specimen in the hospital unit during morning rounds? Option A. It makes patient identification optional. Option B. It eliminates the need to mix tubes. Option C. It determines the patient's fasting status. Option D. It helps prevent additive carryover from altering later specimens. The correct answer is option D. It helps prevent additive carryover from altering later specimens. Additives from one tube can contaminate another tube if collection order is incorrect. Patient identification is required regardless of tube order. Additive tubes still need proper mixing after filling. Fasting status is based on patient preparation, not tube sequence. Question 24. During capillary puncture, which specimen type is generally collected first when ordered while preparing a thyroid panel specimen in the urgent care laboratory? Option A blood gas specimen. Option B serum specimen. Option C gray top microtube. Option D non-additive tube after all others. The correct answer is option A. Blood gas specimen. Capillary specimens are collected in an order that protects tests most affected by clotting and air exposure, with blood gases first when required. Serum is not first when blood gases are ordered. Gray microtubes are collected after more time-sensitive capillary specimens. Non-additive tubes are not automatically collected first in capillary order. Question 25. In the pediatric clinic, which capillary collection order is commonly used after blood gases when EDTA testing is ordered? Option A serum microtube before EDTA for every draw. Option B EDTA microtube before other additive and serum microtubes. Option C gray microtube first even when blood gases are needed. Option D. Any order because capillary tubes have no additives. The correct answer is option B. EDTA microtube before other additive and serum microtubes. EDTA microtubes are collected early in capillary collection to reduce clotting in hematology specimens. Serum first collection can allow clotting before the EDTA specimen is filled. Blood gases are more time-sensitive and generally come first if ordered. Many capillary tubes contain additives, so order still matters. Question 26. For a electrolyte panel collection, which tube is most appropriate for a routine CBC? Option A light blue sodium citrate tube. Option B gray sodium fluoride tube. Option C lavender top tube containing EDTA. Option D red no additive tube. The correct answer is option C. Lavender top tube containing EDTA. EDTA preserves cellular morphology and prevents clotting for hematology testing such as CBC. Citrate is used mainly for coagulation testing. Gray tubes are commonly used for glucose or lactate preservation. A red tube allows serum testing and is not the standard choice for CBC. Question 27. To protect patient safety, which additive is found in a light blue tube used for patient and APTT testing? Option A EDTA. Option B sodium fluoride with potassium oxalate. Option C lithium heparin. Option D sodium citrate. The correct answer is option D. Sodium citrate. Sodium citrate binds calcium in a controlled ratio so coagulation testing can be performed accurately. EDTA is used mainly for hematology and can interfere with coagulation testing. Fluoride/oxalate is used mainly to preserve glucose or lactate. Heparin is used for plasma chemistry tests rather than routine patient or APTT tubes. Question 28. After reviewing the order, which tube is commonly selected for many serum chemistry tests when gel separation is desired? Option A serum separator tube with clot activator and gel. Option B lavender EDTA tube. Option C light blue citrate tube. Option D gray fluoride tube only. The correct answer is option A. Serum separator tube with clot activator and gel. A serum separator tube allows clotting and then separates serum from cells using gel after centrifugation. EDTA plasma is not serum and can interfere with some chemistry tests. Citrate plasma is intended primarily for coagulation testing. Gray tubes preserve glucose but are not the general serum separator choice. Question 29. When preparing for collection, which tube is commonly associated with heparinized plasma chemistry testing? Option A lavender top tube. Option B green top tube. Option C light blue top tube. Option D pink top tube. The correct answer is option B. Green top tube. Green top tubes commonly contain heparin, which prevents clotting and provides plasma for chemistry testing. Lavender tubes contain EDTA for hematology. Light blue tubes contain citrate for coagulation testing. Pink tubes contain EDTA and are commonly used for blood bank testing. Question 30. In a routine phlebotomy scenario, which tube is most commonly used for glucose preservation when testing may be delayed? Option A plain red tube only. Option B light blue citrate tube. Option C gray top tube with sodium fluoride and an anticoagulant. Option D blood culture bottle. The correct answer is option C. Gray top tube with sodium fluoride and an anticoagulant. Sodium fluoride inhibits glycolysis, helping preserve glucose concentration before analysis. A plain red tube does not contain glycolysis inhibitor. Citrate is used for coagulation studies, not routine glucose preservation. Blood culture bottles are for detecting microorganisms, not preserving glucose. Question 31. Before proceeding with the draw, which tube is commonly used for blood bank testing such as type and screen? Option A gray top fluoride tube. Option B light blue citrate tube. Option C green heparin tube for every blood bank test. Option D pink top EDTA tube. The correct answer is option D. Pink top EDTA tube. Pink top EDTA tubes are commonly used for blood bank specimens because they preserve cells and prevent clotting. Gray tubes are associated with glucose or lactate preservation. Light blue citrate tubes are for coagulation testing. Green heparin tubes are not the routine tube for type and screen. Question 32. During a scenario, which tube is generally collected for a blood culture specimen? Option A sterile blood culture bottle or SBS containing culture tube according to policy. Option B lavender EDTA tube only. Option C gray fluoride tube. Option D SST after clotting. The correct answer is option A. Sterile blood culture bottle or SBS containing culture tube according to policy. Blood cultures require sterile collection into a culture system designed to support organism recovery. A lavender tube is not designed as the primary blood culture container. A gray tube preserves glucose and does not support blood culture protocols. An SST is for serum separation, not microorganism culture. Question 33. Why must a light blue citrate tube be filled to the proper level in the dialysis adjacent clinic during a competency review? Option A. The tube color changes if underfilled. Option B. The blood to anticoagulant ratio must be correct for coagulation results. Option C. EDTA needs extra room to mix. Option D. Serum cannot clot unless the tube is full. The correct answer is option B. The blood to anticoagulant ratio must be correct for coagulation results. Coagulation testing depends on a precise citrate to blood ratio, commonly described as 1 part citrate to 9 parts blood. Tube color does not change to warn of underfilling. EDTA is not the additive in a light blue citrate tube. Light blue tubes contain anticoagulant and are not collected to obtain serum clotting. Question 34. After collecting an additive tube, how should it usually be mixed in the student skills lab during a final review? Option A. Shake it hard until bubbles appear. Option B. Leave it unmixed until centrifugation. Option C. Gently invert the tube the recommended number of times. Option D. Open the stopper and stir with a wooden applicator. The correct answer is option C. Gently invert the tube the recommended number of times. Gentle inversion evenly distributes additive while reducing cell trauma. Vigorous shaking can cause hemolysis. Failure to mix can allow clotting or poor additive action. Opening a tube risks exposure, contamination, and specimen loss. Question 35. To protect patient safety, which problem can occur if a lavender EDTA tube is not mixed soon after filling? Option A. The tube becomes sterile for culture. Option B. The specimen turns into serum. Option C. The sodium citrate ratio improves. Option D. Microclots may form and make hematology results unreliable. The correct answer is option D. Microclots may form and make hematology results unreliable. EDTA must contact the blood promptly to prevent clot formation in hematology specimens. Mixing does not create sterility for culture testing. A lavender tube is intended for anticoagulated whole blood or plasma, not serum. Sodium citrate is not the additive in a lavender EDTA tube. Question 36. After reviewing the order, which practice helps reduce hemolysis during a routine type and screen collection? Option A. Use appropriate needle size and gently invert tubes instead of shaking them. Option B. Force blood rapidly through a small needle. Option C. Shake additive tubes vigorously. Option D. Pull back a syringe plunger as hard as possible. The correct answer is option A. Use appropriate needle size and gently invert tubes instead of shaking them. Gentle handling and appropriate equipment reduce red blood cell rupture. Forcing blood through a small needle can damage cells. Vigorous shaking is a common cause of hemolysis. Excessive syringe force can rupture cells and compromise results. Question 37. When preparing for collection, which laboratory result is especially affected by hemolysis because red cells release intracellular contents in the outpatient clinic during a clinical simulation? Option A. Patient date of birth becomes invalid. Option B. Potassium may be falsely increased. Option C. Tube expiration date is extended. Option D. Tourniquet pressure becomes lower. The correct answer is option B. Potassium may be falsely increased. Hemolysis releases intracellular potassium from red blood cells and can falsely elevate measured potassium. Patient demographics are not changed by cell rupture. A specimen problem cannot extend tube expiration. Tourniquet pressure is unrelated to the analyzer result after hemolysis. Question 38. When using a syringe for blood transfer, which method best protects specimen quality in the hospital unit during morning rounds during a review? Option A. Remove the tube stopper and push blood in forcefully. Option B. Squirt blood through the needle into each tube. Option C. Use a safety transfer device and allow blood to flow gently into tubes. Option D. Shake each tube hard to remove clots. The correct answer is option C. Use a safety transfer device and allow blood to flow gently into tubes. A safety transfer device reduces needle stick risk and minimizes pressure-related cell damage. Removing stoppers increases exposure and contamination risk. Pushing blood through a needle can cause hemolysis and Sharp's injury. Shaking tubes can rupture cells and worsen specimen quality. Question 39. Why should alcohol be allowed to dry before puncture in the urgent care laboratory during a mock exam? Option A. Dry alcohol makes the tube additive stronger. Option B. Wet alcohol improves vein anchoring. Option C. Alcohol drying replaces tourniquet use. Option D. Wet alcohol can cause stinging and may contribute to hemolysis or specimen contamination. The correct answer is option D. Wet alcohol can cause stinging and may contribute to hemolysis or specimen contamination. Air drying supports proper antisepsis and prevents wet alcohol from entering the specimen path. Drying does not change the chemical strength of tube additives. Vein anchoring depends on hand technique, not wet alcohol. Tourniquet use is a separate step for vein distension. Question 40. During a skills check, which specimen often requires protection from light after collection in the pediatric clinic during a skills check? Option A. Bilirubin specimen. Option B. CBC specimen for platelet count. Option C. Routine sodium citrate coagulation tube. Option D. Blood culture bottle during incubation. The correct answer is option A. Bilirubin specimen. Bilirubin is light sensitive and may decrease if the specimen is exposed to light. CBC specimens require mixing and timely testing, not routine light protection for platelet count. Citrate coagulation specimens require correct fill and processing, not light protection as the key issue. Blood cultures require sterile handling and incubation, not wrapping for light protection as the primary step. Question 41. In the long-term care unit, which specimen commonly requires rapid transport on ice or chilled handling according to policy? Option A. Routine CBC kept for the next day. Option B. Ammonia specimen. Option C. Serum separator tube for a lipid panel after clotting only. Option D. Blood culture bottle placed in the freezer. The correct answer is option B. Ammonia specimen. Ammonia specimens are time-sensitive and commonly require chilling and prompt processing. A routine CBC should not simply be held for the next day without stability guidance. A lipid panel does not share the same immediate chilled handling requirement as ammonia. Blood culture bottles should not be frozen because organisms must remain viable for detection. Question 42. For a therapeutic drug level collection, which action best maintains specimen integrity during transport to the laboratory? Option A. Store every specimen at room temperature overnight. Option B. Centrifuge every tube immediately regardless of type. Option C. Follow required time, temperature, light, and handling instructions for the ordered test. Option D. Place all blood specimens in direct sunlight. The correct answer is option C. Follow required time, temperature, light, and handling instructions for the ordered test. Different tests have specific stability requirements, so handling must match the test and facility policy. Overnight room temperature storage can make many specimens unacceptable. Some tubes should not be centrifuged immediately or at all before required steps. Sunlight can degrade light-sensitive analytes and warm specimens. Question 43. If a specimen must be transported cold, which approach is appropriate in the emergency department bay during a competency review? Option A. Submerge the tube in loose ice water. Option B. Hold it in a bare hand to keep it visible. Option C. Place it near a heater until pickup. Option D. Place the specimen in the approved cooling method without direct water contamination. The correct answer is option D. Place the specimen in the approved cooling method without direct water contamination. Cooling must preserve the required temperature while protecting the label and tube from contamination or leakage. Loose ice water can damage labels and create contamination issues. Holding the specimen warms it and defeats the cold requirement. A heater can destabilize temperature-sensitive analytes. Question 44. After reviewing the order, which situation is a common reason for specimen rejection in the physician office lab during a final review? Option A, wrong tube type or insufficient specimen volume. Option B, collector wore gloves. Option C, patient stated date of birth. Option D, tube was labeled at the bedside. The correct answer is option A. Wrong tube type or insufficient specimen volume. Wrong container choice or inadequate volume can prevent accurate testing and may require recollection. Wearing gloves is expected when blood exposure is possible. Patient-stated identifiers support accurate identification. Bedside labeling is the correct practice. Question 45. Why should tube expiration dates be checked before collection in the community health screening event during a study session? Option A, expired tubes identify patients faster. Option B, expired tubes may have inadequate vacuum or unreliable additive performance. Option C, expired tubes prevent hemolysis in every case. Option D, expired tubes are required for coagulation testing. The correct answer is option B. Expired tubes may have inadequate vacuum or unreliable additive performance. Tube vacuum and additive quality can decline after expiration, compromising specimen volume or test accuracy. Expiration dates do not help verify identity. No expired tube can guarantee hemolysis prevention. Coagulation testing requires properly filled, unexpired citrate tubes. Question 46. A patient scheduled for a fasting lipid panel says they ate breakfast. Which action is best in the preoperative testing area during a structured exam prep drill? Option A, draw the specimen and write fasting on the label. Option B, tell the patient not to mention the meal. Option C, follow facility policy by notifying the appropriate person and documenting or rescheduling as directed. Option D, cancel every test without notifying anyone. The correct answer is option C. Follow facility policy by notifying the appropriate person and documenting or rescheduling as directed. Fasting status affects certain tests, so the discrepancy must be handled through policy and communication. Marking the specimen as fasting would be inaccurate documentation. Hiding the meal prevents proper interpretation of results. Canceling without communication may disrupt care and exceed the phlebotomist's role. Question 47. Why is fasting status important before some chemistry tests in the Oncology Infusion Center during a clinical simulation? Option A, food changes the patient's legal name. Option B, fasting makes needles sterile. Option C, fasting eliminates the need for tube mixing. Option D, food intake can alter analytes such as glucose or lipids. The correct answer is option D. Food intake can alter analytes such as glucose or lipids. Some blood values vary after eating, so fasting helps standardize interpretation. Food intake does not affect patient identity. Sterility comes from equipment and technique, not fasting. Additive tubes still require proper mixing regardless of fasting status. Question 48. For a medication trough level, when is the specimen usually collected in the dialysis adjacent clinic during a review? Option A, immediately before the next scheduled dose. Option B, immediately after the medication is swallowed. Option C, at any random time during the day. Option D, only after the medication is discontinued for a week. The correct answer is option A. Immediately before the next scheduled dose. A trough measures the lowest drug concentration, typically just before the next dose. Immediately after dosing reflects absorption or peak timing, not trough. Random timing can make therapeutic drug results difficult to interpret. Stopping medication for a week is not the routine way to collect a trough. Question 49. During a glucose tolerance test, why must collection times be followed carefully in the student skills lab during a mock exam? Option A. Any time is acceptable if the tubes are gray. Option B, timed results show how the body responds to a measured glucose dose. Option C, timing only matters after the last tube. Option D. The patient should eat between timed draws to stay comfortable. The correct answer is option B. Timed results show how the body responds to a measured glucose dose. Glucose tolerance testing depends on comparing specimens at specific intervals after glucose administration. Tube type does not remove the need for precise timing. Every scheduled interval matters for interpretation. Eating during the test can invalidate the glucose response pattern. Question 50. For a fasting glucose collection, which documentation is especially important for a timed specimen? Option A. The phlebotomist's favorite tube brand. Option B. Only the patient's room number. Option C. Exact collection time recorded on the label or requisition according to policy. Option D. A note saying collected sometime today. The correct answer is option C. Exact collection time recorded on the label or requisition according to policy. Timed tests require accurate collection time so results can be interpreted correctly. Tube brand does not communicate timing. Room number is not a valid substitute for collection time. Vague timing can make the specimen clinically unreliable. Question 51. Before collecting blood cultures, why is careful skin antisepsis critical in the blood collection station during a practice drill? Option A. It makes EDTA tubes clot faster. Option B. It eliminates the need for sterile bottles. Option C. It changes venous blood into arterial blood. Option D. It reduces contamination that could cause a false positive culture. The correct answer is option D. It reduces contamination that could cause a false positive culture. Blood cultures are highly sensitive to skin organisms, so antisepsis helps ensure organisms detected are clinically meaningful. EDTA clotting is unrelated to culture site preparation. Sterile collection containers are still required. Skin antisepsis does not change the type of blood collected. Question 52. When collecting blood cultures with other tubes, which priority is most important in the outpatient clinic during a scenario? Option A. Maintain sterility and collect cultures before non-sterile tubes. Option B. Collect cultures after gray tubes. Option C. Touch the bottle tops after cleaning to confirm dryness. Option D. Use a non-sterile transfer cup. The correct answer is option A. Maintain sterility and collect cultures before non-sterile tubes. Blood cultures must be protected from contamination because false positives can lead to unnecessary treatment. Collecting cultures after other tubes increases contamination risk. Touching clean tops can recontaminate them. A non-sterile transfer process defeats the purpose of sterile collection. Question 53. If using a winged set for blood cultures, why is bottle order guided by facility policy in the hospital unit during morning rounds during a competency review? Option A. The order determines the patient's identity. Option B. Air in the tubing can affect which bottle should be filled first. Option C. The order prevents the need to clean the site. Option D. The order makes the needle reusable. The correct answer is option B. Air in the tubing can affect which bottle should be filled first. Butterfly tubing contains air, and culture bottle order may be chosen to manage that air safely. Bottle order does not verify patient identity. Skin and bottle antisepsis are still required. Needles are single-use and cannot be reused. Question 54. For an infant heel stick, which area is safest for puncture while preparing a thyroid panel specimen in the urgent care laboratory? Option A. Posterior curvature of the heel. Option B. Center of the arch. Option C. Medial or lateral plantar surface of the heel. Option D. Tip of the great toe. The correct answer is option C. Medial or lateral plantar surface of the heel. The medial or lateral plantar heel avoids deeper structures when an appropriate lancet depth is used. The posterior curvature increases risk of bone injury. The arch is not an approved heel stick site. The great toe is not the standard infant heel stick site. Question 55. Why should an infant heel puncture not be too deep while preparing a hemoglobin A1C specimen in the pediatric clinic? Option A. A deeper puncture always prevents hemolysis. Option B. Depth determines the tube color. Option C. A deep puncture replaces the need for warming. Option D. Excessive depth can injure bone or deeper tissue. The correct answer is option D. Excessive depth can injure bone or deeper tissue. Infants have small heels, and excessive lancet depth can damage underlying structures. Deeper puncture can increase injury and does not guarantee specimen quality. Tube color is selected by test requirements, not puncture depth. Warming is a separate step used to improve blood flow when appropriate. Question 56. During a structured exam prep drill, which finger is generally preferred for adult capillary puncture while preparing an electrolyte panel specimen in the long-term care unit? Option A. Middle or ring finger on the palmar surface near the side of the fingertip. Option B. Thumb pad for every test. Option C. Index fingertip in all adults. Option D. Little finger near the bone. The correct answer is option A. Middle or ring finger on the palmar surface near the side of the fingertip. The middle or ring finger usually has adequate tissue and less callus than other fingers. The thumb may be more calloused and is not the routine first choice. The index finger is often more sensitive and calloused. The little finger has less tissue over bone and higher injury risk. Question 57. After a finger puncture, why is the first drop of blood commonly wiped away while preparing a therapeutic drug level specimen in the mobile collection site? Option A. It contains only white blood cells. Option B. It may contain tissue fluid or contaminants that can affect the specimen. Option C. It proves the patient is fasting. Option D. It activates the tube vacuum. The correct answer is option B. It may contain tissue fluid or contaminants that can affect the specimen. The first drop can be diluted with tissue fluid or skin contaminants, so wiping it improves specimen quality for many tests. The first drop is not composed only of white blood cells. Fasting status cannot be determined from the first drop. Capillary collection does not depend on evacuated tube vacuum at the puncture site. Question 58. How can warming a capillary puncture site help collection while preparing a bilirubin specimen in the emergency department bay? Option A. It sterilizes the skin completely. Option B. It removes the need to identify the patient. Option C. It increases local blood flow when used safely. Option D. It makes every specimen suitable for culture. The correct answer is option C. It increases local blood flow when used safely. Warmth can improve capillary blood flow and reduce the need for excessive squeezing. Warming does not sterilize skin. Patient identification is still mandatory. Capillary specimens are not automatically suitable for blood culture collection. Question 59. Why should excessive squeezing or milking be avoided during capillary collection while preparing a ammonia specimen in the physician office lab? Option A. It improves all glucose results. Option B. It makes EDTA unnecessary. Option C. It prevents clotting in serum tubes. Option D. It can dilute the specimen with tissue fluid and cause hemolysis. The correct answer is option D. It can dilute the specimen with tissue fluid and cause hemolysis. Excessive pressure can alter specimen composition and damage cells. Glucose results can be affected by poor specimen quality rather than improved. EDTA is still needed when an EDTA microtube is required. Serum tubes are intended to clot and are not protected by squeezing. Question 60. When is dermal puncture commonly preferred over venipuncture while preparing a lactate specimen in the community health screening event? Option A. For some infants, small volume tests, or patients with difficult veins when appropriate. Option B. For every blood culture set. Option C. For all coagulation studies regardless of policy. Option D, whenever patient identification is incomplete. The correct answer is option A. For some infants, small volume tests, or patients with difficult veins when appropriate. Dermal puncture can be useful when only small volumes are needed or venipuncture is difficult. Blood cultures usually require sterile venipuncture collection and adequate volume. Coagulation testing has strict specimen requirements and is not automatically dermal. Incomplete identification must be resolved before any collection method. Question 61. A child begins to pull away during a draw. Which action supports safety while preparing a CBC specimen in the preoperative testing area? Option A, continue while the arm is moving. Option B, pause if needed and obtain appropriate assistance for safe positioning according to policy. Option C, scold the child until they stop. Option D, ask another child to hold the arm. The correct answer is option B. Pause if needed and obtain appropriate assistance for safe positioning according to policy. Safe positioning prevents sudden movement that could injure the child or phlebotomist. Continuing while the arm moves increases injury risk. Scolding is not therapeutic and can escalate fear. Another child is not appropriate assistance for a procedure. Question 62. In a routine phlebotomy scenario, which explanation is best for a young child before a fingerstick while preparing a patient/INR specimen in the Oncology Infusion Center? Option A, tell the child nothing will happen. Option B, use detailed adult medical terminology. Option C, use simple honest words such as a quick pinch and explain what they can do to help. Option D, promise a toy only if they do not cry. The correct answer is option C. Use simple honest words such as a quick pinch and explain what they can do to help. Age-appropriate honesty helps the child understand and cooperate without unnecessary fear. Saying nothing will happen is misleading. Complex terminology can confuse or frighten a young child. Tying a reward to not crying can shame a normal fear response. Question 63. For an older adult with fragile veins, which technique is most appropriate while preparing a basic metabolic panel specimen in the dialysis adjacent clinic? Option A, slap the site hard to make veins appear. Option B, use the largest needle available. Option C, leave the tourniquet on for several minutes. Option D, use gentle anchoring and consider a smaller needle or controlled collection device. The correct answer is option D. Use gentle anchoring and consider a smaller needle or controlled collection device. Fragile veins need careful stabilization and equipment that reduces trauma or collapse. Slapping can injure delicate skin and is unprofessional. A large needle can worsen trauma. Prolonged tourniquet time increases hemoconcentration and bruising risk. Question 64. Why should adhesive bandages be used carefully on some older adults while preparing a blood culture specimen in the student skills lab? Option A, fragile skin can tear when adhesive is removed. Option B, adhesive changes the blood type. Option C, older adults never need pressure after draws. Option D, bandages prevent all anticoagulant bleeding. The correct answer is option A. Fragile skin can tear when adhesive is removed. Aging skin may be thin and easily damaged, so pressure wrap or gentle dressing choices may be needed. Adhesive has no effect on blood type. Older adults still need pressure until bleeding stops. A bandage does not eliminate bleeding risk, especially with anticoagulants. Question 65. Before assembling equipment for a fasting glucose draw, which item should be checked in the occupational health clinic during a study session? Option A. Only the color of the chair. Option B, tube type, expiration date, needle safety device, and requisition requirements. Option C. The patient's favorite beverage. Option D. The brand of wall clock in the room. The correct answer is option B. Tube type, expiration date, needle safety device, and requisition requirements. Checking supplies before collection helps prevent wrong container use, expired tubes, and safety device problems. Chair color has no role in specimen acceptability. Favorite beverage is not part of collection equipment verification. The wall clock brand does not confirm correct supplies or orders. Question 66. For a type and screen collection, which sequence is safest after blood has entered the final tube in the blood collection station during a structured exam prep drill? Option A, withdraw needle with tourniquet tight and no gauze ready. Option B, activate safety device before removing the needle from the arm. Option C, release tourniquet, remove tube, place gauze, withdraw needle, activate safety device, apply pressure. Option D, remove the needle and recap it before pressure. The correct answer is option C. Release tourniquet, remove tube, place gauze, withdraw needle, activate safety device, apply pressure. The final steps should reduce venous pressure, prepare for bleeding control, and secure the sharp immediately. Withdrawing with the tourniquet tight can increase bleeding and bruising. Most safety devices are activated after withdrawal unless the device instructions say otherwise. Recapping a contaminated needle creates sharp's injury risk. Question 67. To protect patient safety, which action should occur before leaving the patient after venipuncture while preparing a lipid panel specimen in the outpatient clinic? Option A, leave while blood is still oozing. Option B, tell the patient to remove the bandage immediately. Option C, dispose of sharps after walking to another room. Option D, confirm bleeding has stopped and provide appropriate post-draw instructions. The correct answer is option D. Confirm bleeding has stopped and provide appropriate post-draw instructions. Post-draw assessment helps prevent bleeding, bruising, and delayed complications. Leaving active bleeding unattended is unsafe. Immediate bandage removal can restart bleeding. Sharps must be disposed of promptly in the collection area. Question 68. Why is patient positioning important before venipuncture while preparing a troponin specimen in the hospital unit during morning rounds? Option A. It reduces the risk of falls or injury if the patient becomes dizzy. Option B. It makes labeling unnecessary. Option C. It changes EDTA into citrate. Option D. It allows the needle to be reused safely. The correct answer is option A. It reduces the risk of falls or injury if the patient becomes dizzy. A seated or lying position with arm support protects the patient if syncope occurs. Proper positioning does not replace specimen labeling. Body position does not change tube additives. Needles are single-use and cannot be reused. Question 69. When preparing for collection, which patient instruction is appropriate after a routine venipuncture while preparing a thyroid panel specimen in the urgent care laboratory? Option A, scratch the site if it feels itchy. Option B, keep pressure on the site and avoid heavy lifting with that arm for a short time if advised. Option C, remove the bandage while still bleeding. Option D, bend the elbow tightly for 10 minutes. The correct answer is option B. Keep pressure on the site and avoid heavy lifting with that arm for a short time if advised. Post-draw instructions support clot formation and reduce bruising or bleeding. Scratching can disrupt the site and introduce contamination. Removing a bandage during bleeding can restart or worsen bleeding. Bending the elbow tightly can increase bruising. Question 70. In a routine phlebotomy scenario, which laboratory department commonly performs CBC testing in the pediatric clinic during a skills check? Option A, microbiology only. Option B, blood bank only. Option C, hematology. Option D, histology only. The correct answer is option C. Hematology. Hematology evaluates blood cells and commonly performs CBC testing. Microbiology focuses on organisms and cultures. Blood bank focuses on compatibility and transfusion-related testing. Histology focuses on tissue specimens rather than routine CBC testing. Question 71. Before proceeding with the draw, which department usually performs patient and APTT coagulation testing in the long-term care unit during a practice drill? Option A, urinalysis only. Option B, microbiology culture bench only. Option C, cytology screening only. Option D, coagulation or hematology coagulation section. The correct answer is option D. Coagulation or hematology coagulation section. Coagulation testing evaluates clotting pathways and is commonly handled in a coagulation section. Urinalysis focuses on urine specimens. Microbiology culture benches identify organisms rather than routine clotting times. Cytology examines cells for diagnostic changes, not standard coagulation studies. Question 72. During a scenario, which department is most associated with blood cultures in the mobile collection site during a scenario? Option A, microbiology. Option B, blood bank compatibility only. Option C, histology tissue processing. Option D, chemistry electrolyte analysis only. The correct answer is option A. Microbiology. Microbiology processes cultures to detect and identify microorganisms. Blood bank testing focuses on transfusion compatibility. Histology processes tissue rather than blood culture bottles. Chemistry analyzes chemical constituents and is not the main culture department. Question 73. In the emergency department bay, which department commonly performs type and screen testing? Option A, microbiology only. Option B, blood bank or transfusion services. Option C, chemistry only. Option D, parasitology stool testing only. The correct answer is option B. Blood bank or transfusion services. Blood bank testing supports transfusion safety by determining blood type and antibody screen results. Microbiology focuses on infectious organisms. Chemistry focuses on analytes such as glucose and electrolytes. Parasitology stool testing does not perform transfusion compatibility testing. Question 74. For a ammonia collection, which department commonly analyzes electrolytes such as sodium and potassium? Option A, histology. Option B, blood bank compatibility bench. Option C, chemistry. Option D, cytogenetics only. The correct answer is option C. Chemistry. Chemistry measures dissolved analytes such as electrolytes, enzymes, hormones, and metabolites. Histology focuses on tissues. Blood bank compatibility testing is not the routine electrolyte section. Cytogenetics focuses on chromosomes or genetic studies, not routine electrolytes. Question 75. To protect patient safety, which practice is part of phlebotomy quality assurance in the community health screening event during a study session? Option A, ignoring mislabeled specimens if the patient is well known. Option B, changing tube labels after results are reported. Option C, skipping competency checks for experienced staff. Option D, tracking specimen errors and using corrective action to prevent recurrence. The correct answer is option D. Tracking specimen errors and using corrective action to prevent recurrence. Quality assurance identifies errors and improves processes so patients receive reliable results. Familiarity with a patient does not make a mislabeled specimen acceptable. Changing labels after reporting hides errors and compromises traceability. Competency checks help maintain consistent safe practice for all staff. Question 76. Why are competency assessments important for phlebotomists in the preoperative testing area during a structured exam prep drill? Option A. They verify that staff can perform required skills safely and consistently. Option B. They replace all written procedures. Option C. They allow staff to ignore order of draw. Option D. They are only for patients who complain. The correct answer is option A. They verify that staff can perform required skills safely and consistently. Competency assessment supports safe patient care and consistent specimen quality. Written procedures are still needed as standards for practice. Order of draw remains important regardless of competency status. Competency is a proactive quality process, not only a reaction to complaints. Question 77. When preparing for collection, which error should be reported through the facility's quality process in the Oncology Infusion Center during a clinical simulation? Option A. A patient correctly states their date of birth. Option B. A specimen collected in the wrong tube type. Option C. A tube is mixed according to instructions. Option D. A needle safety device is activated after use. The correct answer is option B. A specimen collected in the wrong tube type. Wrong tube collection can cause test cancellation or inaccurate results and should be tracked for improvement. Correct identity confirmation is expected practice, not an error. Proper tube mixing supports quality. Activating a safety device after use is the intended safety behavior. Question 78. In a routine phlebotomy scenario, which activity is commonly associated with CLIA waived point-of-care testing in the dialysis-adjacent clinic during a review? Option A. Changing the test procedure to save time. Option B. Reporting results without controls when controls are required. Option C. Following manufacturer instructions and documenting quality control for a simple approved test. Option D. Using expired test strips because they look normal. The correct answer is option C. Following manufacturer instructions and documenting quality control for a simple approved test. Waived testing is simple but still requires following instructions, QC, and documentation. Modifying the procedure can invalidate the test category and results. Skipping required controls undermines result reliability. Expired strips may produce inaccurate results even if they look acceptable. Question 79. Before performing a fingerstick glucose test, which step supports accurate point-of-care results in the student skills lab during a mock exam? Option A. Use a strip from an unlabeled loose container. Option B. Skip patient identification because the device stores results. Option C. Apply disinfectant and test before the site dries. Option D. Confirm test strip expiration and run required quality control according to policy. The correct answer is option D. Confirm test strip expiration and run required quality control according to policy. Expiration checks and QC help ensure the device and strips are producing reliable results. Loose unlabeled strips may be expired or contaminated. Device storage does not replace identifying the patient. Testing before the site dries can contaminate or dilute the sample. Question 80. Why must abnormal point-of-care results be handled according to facility policy in the occupational health clinic during a skills check? Option A. Critical or unexpected results may require confirmation, documentation, or immediate notification. Option B. Abnormal results should always be erased. Option C. Only normal results belong in the medical record. Option D. The patient should interpret the result without staff involvement. The correct answer is option A. Critical or unexpected results may require confirmation, documentation, or immediate notification. Policies define how to verify, document, and communicate results that may affect patient care. Erasing abnormal results hides clinically important information. Both normal and abnormal results may require documentation. Patients should receive appropriate clinical guidance rather than interpreting serious results alone. Question 81. In the blood collection station, which blood component is primarily responsible for carrying oxygen? Option A. Sodium citrate in plasma. Option B. Hemoglobin inside red blood cells. Option C. Platelet granules only. Option D. Tube separation gel. The correct answer is option B. Hemoglobin inside red blood cells. Hemoglobin within red blood cells binds and transports oxygen throughout the body. Sodium citrate is a tube additive, not an oxygen carrier. Platelets help hemostasis but do not primarily transport oxygen. Separation gel is part of a tube system, not a blood component. Question 82. For a lipid panel collection, which blood component is most directly involved in forming the initial platelet plug? Option A, albumin only. Option B, glucose molecules. Option C, platelets. Option D, chloride ions. The correct answer is option C. Platelets. Platelets adhere and aggregate at injury sites to begin primary hemostasis. Albumin helps maintain oncotic pressure and transport substances but is not the platelet plug. Glucose is an energy source, not a clotting cell fragment. Chloride is an electrolyte and does not form platelet plugs. Question 83. To protect patient safety, which vessel type is normally used for routine venipuncture in the hospital unit during morning rounds during a competency review? Option A, artery. Option B, lymphatic duct. Option C, tendon sheath. Option D, vein. The correct answer is option D. Vein. Veins are lower pressure vessels that are routinely accessed for diagnostic blood collection. Arterial puncture is a different procedure and not routine venipuncture. Lymphatic ducts do not provide venous blood specimens. A tendon sheath is not a blood vessel and must be avoided. Question 84. Why is the basilic vein approached with extra caution in the urgent care laboratory during a final review? Option A. It lies near nerves and arteries in the antecubital area. Option B. It contains no venous blood. Option C. It always has a built-in tourniquet. Option D. It cannot be palpated in any patient. The correct answer is option A. It lies near nerves and arteries in the antecubital area. The basilic area has nearby structures that increase the consequence of poor needle placement. The basilic vein does contain venous blood. No vein has a built-in tourniquet. The vein may be palpable, but caution is still needed because of anatomy. Question 85. When preparing for collection, which term describes stopping bleeding after vessel injury in the pediatric clinic during a study session? Option A, hemolysis. Option B, hemostasis. Option C, glycolysis. Option D, hemoconcentration. The correct answer is option B. Hemostasis. Hemostasis is the process that stops bleeding through vascular response, platelets, and coagulation. Hemolysis is red cell rupture. Glycolysis is glucose metabolism by cells. Hemoconcentration is increased concentration of blood components from fluid shifts. Question 86. A clotted lavender tube is received for CBC testing. Why is recollection usually needed in the long-term care unit during a structured exam prep drill? Option A, clotting proves the patient was fasting. Option B, clots improve automated CBC accuracy. Option C, clots trap cells and make cell counts unreliable. Option D, lavender tubes are supposed to clot before testing. The correct answer is option C. Clots trap cells and make cell counts unreliable. CBC testing requires a well-mixed anticoagulated specimen so cells remain evenly suspended. Fasting status is unrelated to clot formation in an EDTA tube. Clots can block analyzers or distort cell counts. Lavender tubes contain EDTA and should not clot when properly mixed and filled. Question 87. An underfilled light blue tube arrives for patient testing. What is the main concern in the mobile collection site during a clinical simulation? Option A. The specimen will become a blood culture. Option B. The tube will automatically refill in the lab. Option C. The patient's identity becomes verified. Option D. Excess citrate relative to blood may alter coagulation results. The correct answer is option D. Excess citrate relative to blood may alter coagulation results. Underfilling changes the anticoagulant to blood ratio and can make coagulation results inaccurate. A citrate tube cannot become a blood culture bottle. Tubes do not refill after collection. Fill volume has no role in verifying identity. Question 88. During a review, which additive can falsely increase potassium if carried into a chemistry tube in the emergency department bay during a review? Option A, potassium EDTA. Option B, clot activator gel only. Option C, sodium fluoride without potassium. Option D, sterile culture broth only. The correct answer is option A. Potassium EDTA. Potassium EDTA carryover can contaminate chemistry specimens and falsely elevate potassium while lowering calcium. Gel itself does not add potassium in the same way EDTA contamination does. Sodium fluoride is associated with glucose preservation, not potassium EDTA effects. Culture broth is used for organism recovery and is not the classic potassium carryover problem. Question 89. In the physician office lab, which tube should generally be collected before a lavender EDTA tube in venipuncture order? Option A, gray fluoride tube after lavender only. Option B, green heparin tube. Option C, another lavender tube for every test. Option D, no tube because EDTA always comes first. The correct answer is option B, green heparin tube. In the standard sequence, heparin tubes are collected before EDTA tubes to limit additive carryover effects. Gray tubes generally follow EDTA, not precede it as the key before lavender tube. Collecting another lavender tube does not answer the order requirement. EDTA does not always come first and can interfere with later tests. Question 90. For a lactate collection, which instruction is commonly given for a fasting blood test unless policy says otherwise? Option A, drink sugary beverages before arrival. Option B, chew gum with sugar during the fast. Option C, avoid food and most beverages except water for the required fasting period. Option D, eat a small snack because it will not matter. The correct answer is option C. Avoid food and most beverages except water for the required fasting period. Fasting helps standardize results for tests affected by recent food intake. Sugary beverages can alter glucose and other chemistry results. Sugared gum can break the fast for some testing instructions. A snack can invalidate fasting status for tests that require it. Question 91. If a timed specimen is collected late, which action is most appropriate in the preoperative testing area during a practice drill? Option A, write the scheduled time on the label anyway. Option B, discard the requisition without telling anyone. Option C, change the patient's medication schedule independently. Option D, document the actual collection time and notify the appropriate person according to policy. The correct answer is option D. Document the actual collection time and notify the appropriate person according to policy. Actual collection time is necessary to interpret timed results and decide whether recollection is needed. Writing the scheduled time is inaccurate documentation. Discarding the order without communication disrupts care. Medication timing decisions are outside routine phlebotomy authority. Question 92. After reviewing the order, which action increases the chance of blood culture contamination in the oncology infusion center during a scenario? Option A, repulpating the cleansed site with an unclean glove before needle insertion. Option B, allowing antiseptic to dry. Option C, using sterile culture bottles. Option D, collecting cultures before other tubes. The correct answer is option A. Repulpating the cleansed site with an unclean glove before needle insertion. Touching the disinfected site with an unclean glove can reintroduce skin organisms. Allowing antiseptic to dry supports effective skin preparation. Sterile bottles help maintain specimen integrity. Collecting cultures first helps reduce contamination from other tubes. Question 93. When preparing for collection, which behavior is outside appropriate phlebotomy scope in a routine collection setting in the dialysis adjacent clinic during a competency review? Option A, verifying patient identity. Option B. Interpreting the diagnosis and changing the provider's order independently. Option C. Labeling the specimen at the bedside. Option D. Reporting a specimen problem to the supervisor. The correct answer is option B. Interpreting the diagnosis and changing the provider's order independently. Phlebotomists collect and handle specimens but do not independently diagnose or alter provider orders. Identity verification is a core phlebotomy responsibility. Bedside labeling is expected practice. Reporting problems supports patient safety and quality assurance. Question 94. A patient asks when results will be ready. Which response is most appropriate in the student skills lab during a final review? Option A. Guess a diagnosis from the tube color. Option B. Promise exact results in 5 minutes for every test. Option C. Explain that the laboratory or provider will report results according to facility process. Option D. Tell the patient results are not their concern. The correct answer is option C. Explain that the laboratory or provider will report results according to facility process. The phlebotomist can provide general process information without interpreting or promising results outside their role. Tube color does not allow diagnosis. Turnaround time varies by test and setting, so a universal promise is unsafe. Dismissive language is unprofessional and does not support patient-centered care. Question 95. Before proceeding with the draw, which disposal choice is correct for blood-soaked gauze after a draw in the occupational health clinic during a study session? Option A. Place it in the sharps container. Option B. Put it in a clean supply drawer. Option C. Hand it to the next patient to hold. Option D. Place it in the appropriate biohazard waste container according to policy. The correct answer is option D. Place it in the appropriate biohazard waste container according to policy. Blood-contaminated soft waste belongs in the designated biohazard stream when required by policy. Sharps containers are reserved for needles and other sharps, not soft gauze. A supply drawer must remain clean and uncontaminated. Giving contaminated gauze to another patient creates exposure risk. Question 96. During a structured exam prep drill, which item should never be stored with clean blood collection supplies in the blood collection station during a structured exam prep drill? Option A. Used needles or blood-contaminated materials. Option B. Unopened sterile needles. Option C. Unexpired evacuated tubes. Option D. Clean tourniquets ready for use. The correct answer is option A. Used needles or blood-contaminated materials. Clean supplies must be protected from contamination to prevent patient exposure and specimen problems. Unopened sterile needles are appropriate clean supplies when stored correctly. Unexpired tubes belong with clean collection inventory. Clean tourniquets can be stored for patient use if facility policy permits. Question 97. Why should a phlebotomist follow the facility procedure manual rather than personal shortcuts in the outpatient clinic during a clinical simulation? Option A. Shortcuts are always faster and safer. Option B. Standard procedures support consistent safety, quality, and regulatory compliance. Option C. Procedure manuals are only for new employees. Option D. Regulations do not apply to outpatient settings. The correct answer is option B. Standard procedures support consistent safety, quality, and regulatory compliance. Written procedures create a consistent standard that reduces variation and errors. Shortcuts can bypass safety checks and increase risk. Experienced staff are also expected to follow current procedures. Regulatory and safety expectations apply across collection settings. Question 98. For a troponin collection, which action helps prevent leakage during specimen transport? Option A. Loosen the stopper to release pressure. Option B. Carry open tubes by hand. Option C. Ensure the tube is closed securely and placed in approved transport packaging. Option D. Place tubes loose in a coat pocket. The correct answer is option C. Ensure the tube is closed securely and placed in approved transport packaging. Secure closure and proper packaging protects staff, couriers, and specimen integrity. Loosening the stopper can cause leaks and exposure. Open tubes increase spill and contamination risk. A coat pocket is not approved specimen transport packaging. Question 99. A serum tube and lavender tube are ordered after blood cultures and citrate, which should be collected first in the urgent care laboratory during a mock exam. Option A, lavender before serum. Option B, gray before both in every case. Option C, order does not matter if both are mixed. Option D, serum tube before lavender tube. The correct answer is option D. Serum tube before lavender tube. Serum tubes are collected before EDTA tubes to reduce EDTA carryover into chemistry specimens. Lavender first can contaminate the serum tube with EDTA. Gray tubes are generally later in the order and are not automatically before serum. Mixing tubes does not correct additive carryover. Question 100. After reviewing the order, which tube is most associated with ESR testing in many phlebotomy settings? Option A, lavender EDTA tube or designated black citrate tube depending on method. Option B, blood culture bottle only. Option C, gray fluoride tube for every ESR. Option D, SST for all ESR methods. The correct answer is option A. Lavender EDTA tube or designated black citrate tube depending on method. ESR collection depends on the facility method, commonly EDTA, or a designated citrate ESR tube. Blood culture bottles are for microbiology cultures. Gray fluoride tubes are not the usual universal ESR container. SST serum is not appropriate for all ESR methods because ESR evaluates cellular settling.